Yeah, hello and welcome again to the next case of the month. In this case, a fixed teeth in a day case, in a case where I decided not to go ahead and place the immediate temporary. Now, 3 years later, I've done this case 3 years ago, I would maybe even go for temporary, as we have changed our membrane techniques and fixed the membranes not just buccally but palatally as well, either through stitches or with pins. But let's go through the case bit by bit. As always, great thanks goes to Florian from our laboratory in Munich, and he has done fantastic work. Now we're slowly getting, after 10 years, to a work where we can be happy with. But let's go to the case. Patient with very old work, and can see from the picture smiling already that is probably not something great hiding behind. And there's a temporary denture, or like a telescopic denture, being worn for 15 or 20 years, and a full denture in the lower jaw, of course leading to excessive bone loss. And what we tried to do in this case, try to solve this case completely digitally. That means I put some orthodontic brackets with methacrylate, with with just normal glue, cyanoacrylate, which is acceptable for use. It actually was invented once in the Vietnam War to close wounds of soldiers very quickly, so we don't have a problem to use it intraorally. But of course we have to let the patient know if it's okay for them. But I never had any problems with cyanoacrylate. So orthodontic pins on the tissue, and actually we can use the same orthodontic pins then to take the x-ray, and then we can match the digital scan ideally with the x-ray, and then we can do a guided template with MIS pins, and then our work's absolutely brilliant, and you'll see that in a second. However, we can't do magic. So when we went into the operation and placed the implants, you can see that the implants on the top right and in position 1, 2, and 2, 2 was actually acceptable. But of course the implant in position 2, 4 to 5 in the upper left premolar was questionable for immediate loading. Now I would actually do it, because we have 4 implants, 1 old implant and 3 new implants, fairly stable, and we could risk to use the posterior implant as well. That's the proper bone augmentation, and the distal part of the implant is fully in contact with bone anyway, so not a major problem. And but in this case, however, I decided to not go and place a temporary. Always interesting to see how patients look like a few days after the surgery. This is the 3rd or 4th day after the surgery, which is normal. They always look like a football, and that's of course something I'll tell the patients as well. And in the next picture you can see the patient after 2 weeks, which is completely normal as well. They look even worse if they are on blood thinning medication, rivaroxaban or aspirin or Macomar, whatever you use nowadays. So, and even if they stop for 24 to 36 hours, you can expect a bigger swelling in the operation. And this is then here the final work, upper and lower jaw all on 4, or fixed teeth in a day. I believe in this case already with the Camlog progressive line system. And absolutely wonderful work done by the technician. And now it's up to the patient to keep it clean, and we will remove this work twice a year to make sure that it stays clean. The reasons for tooth loss are still present: periodontitis and decay. Decay wouldn't be as relevant to our implants, of course, but periodontitis can go to peri-implantitis, and that would be a problem for our work. So twice a year removing it, worst of the worst every 3 months. And but for the patient it's quite a large investment, so they normally look after the work themselves. Wonderful gum work here by Florian as well, so very pleased with the result, and so was the patient. Thank you very much for watching this short video, and I wish you all a lovely day and all the success in the world for your work. Thank you very much.